Hi, I just wanted to welcome you all to the Congestive Heart Failure Talk. We've got Teresa Growls, a nurse educator at VCU Health Community Memorial Hospital. She's a resident of Charlotte County, Virginia. She's been a nurse for 37 years, 16 at CMH and 21 at a hospital in South Boston. Teresa earned her nursing degree from Southside Virginia Community College in Keysville and her bachelor's and master's degrees from Chamberlain University. So I will turn it over to her.
Okay, thank you, Christy, and thank everybody for joining us today. We're going to talk a little bit about congestive heart failure and how we can prevent it and how we can treat it, okay? So first of all, we're going to start with a little background of what is congestive heart failure. So many people, when they hear that congestive heart failure, they'll think, hey, my heart is failing, my heart is going to stop. But that is not the case. Congestive heart failure, as you can see on the slide, it is a progressive condition in which the muscles in the heart are unable to pump the blood through the heart or make the heart fill with blood as it should. So what happens with this is the heart muscles become weak, causing some problems with the pumping or the mechanism, the mechanical parts of the heart. And then the heart will have some backup. There'll be some backup, and we'll say, like regurgitation, and this causes people to have fluid, shortness of breath, and we're going to go into that a little bit later. But our body tries to compensate, which causes us to have some other things to happen. So the heart will try to beat faster to help it fill with fluid, or excuse me, fill with blood to run through the heart. So with this, less blood can circulate through the body as it needs to be circulated through the body. It also can cause the heart to enlarge. You may have go to the doctor and he'll say, hey, you know, your heart's a little bit enlarged, nothing to worry about. We need to keep a check on it. And that's what they're watching, is that heart enlargement, because it does cause the heart to enlarge because it causes stretching to try to fill it with blood. And then you will have the backup of the fluid and the blood, and it will cause you to have shortness of breath and fluid. Some of this fluid can be seen in the ankles, feet, legs, and also we have some patients that you'll see it in the abdomen or around the chest. On this screen right here, this shows us what an ejection fraction is. So let me try to explain what an ejection fraction is. And this is how much blood is pumped in and out of the heart. So, of course, and it's in percentage. Everybody kind of thinks, oh, 100%. Well, that's not a normal. A normal is like 50 to 70. So if you have anything below 70, you might be treading on it a little bit, below 50, or if it's down in the red, and that means that we're not really getting that much out. So, we talked about this a little bit, that the blood can back up, which allows fluid to build up in the lungs, and you will experience some shortness of breath and swelling in the extremities. And it's the arms, ankles, legs, and feet. Okay. This is a little bit, or a few facts on congestive heart failure. And we know that as we age, things change about our body. The heart gets a little bit weaker because it's worked so hard for all these years. So the incident of heart failure increases with age. But we do have people that will have congestive heart failure because of underlying conditions at a very early age in life. Approximately 7.5 million people in the United States have heart failure. And approximately 870,000 people will develop heart failure each year. And that's a big, big amount of people. Heart failure is the most common reason for patients over 65 to be admitted to the hospital. Now, these statistics are pre-COVID. You know, during the surge of COVID, we had a lot of people admitted, but pre-COVID, heart failure was the most common reason. Approximately 35% of patients with heart failure are readmitted within 30 days. So why is that, and why do we not want that? Our goal as a healthcare facility, physicians, nurses, is to keep you at home as comfortable as you can and out of the hospital, because we don't, anytime you come into a hospital, there's always risk for catching something or infection or something. But we want to teach you, as we educate the nurses educate you on how to take care of yourself, to keep you out of the hospital. We have nurses on the floor who teach very, very well about congestive heart failure. And I want to go into some of the things that we need you to know and how to keep yourself at home. So you may say, what causes congestive heart failure? Okay, so congestive heart failure can come from narrowing of the arteries of the heart. And you may hear that as coronary artery disease, or CAD. Or you may have a heart attack. The doctor may say, you have a heart attack, so you may have some damage to your heart. And our goal, and I know this is not about congestive heart failure, but our goal is, if you have chest pain, you come to the hospital, we may be able to prevent you from having a heart attack. We may be able to do a stress test, cardiac cath, and say, hey, Mr. Jones, you've got a blockage. Let's go ahead and do a stent, and that can prevent a heart attack. Once that heart attack is there, that muscle of that heart becomes weaker. In turn, you have a high risk of congestive heart failure. Another cause of congestive heart failure is high blood pressure. It leaves the heart weak or too stiff. So when we have high blood pressure, it stiffens the muscle of the heart, which when it stiffens, it is not able to squeeze at the fluid out and the blood out like it should. Inflammation of the heart. I know that you all have heard on the news about myocarditis, and especially in the last year or so. But myocarditis is inflammation of the myocardium of the heart that can cause congestive heart failure as well. And then congenital heart defects. A lot of people, well, not a lot of people, people are born with a problem with the heart that is a congenital defect. Also long-term diseases. And this is the thing that we need to really, really emphasize. There are things that we have, comorbidities, if you want to say it like that, that we may not be able to prevent, but we can control it, such as diabetes. Anybody who has diabetes needs to remember that diabetes can affect every organ of your body, basically. HIV, hypothyroidism, or hyperthyroidism. So, what are some signs and symptoms of congestive heart failure? Shortness of breath when you're during exercise or lying down. Fatigue, get really, really tired, just walk into the bathroom or walk into the kitchen to get you something to eat. Weakness, edema, which is swelling in the legs, ankles, and or feet, or they can also have it in the stomach, the back, rapid or irregular heartbeat, persistent cough or wheezing with white or pink tinged phlegm. And some people also have congestive heart failure. They will have what we call a dry, hacky cough. And it's because of the regurgitation, the backup of that fluid. Gastrointestinal bloating or water retention, so right around the abdomen. Their legs, feet, ankles may look perfect, but then they'll start to have some, as you want to call it, belly bloating. Their belly will get bloated. Excessive urination at night. People who get up all times of night. And I realize that this also can come from other things, but it's something that you need to make sure that your doctor knows about. Weight gain and chest pain. And I'm going to tell you how that we can know if we're gaining fluid. Okay, so the best way to avoid congestive heart failure is to avoid the conditions that cause it, such as take care of your heart. If you're diabetic, take care of your diabetes. So stop smoking. If you are a smoker, please stop smoking. We all know that smoking affects the lungs, but it affects the heart. It causes buildup and can cause coronary artery disease, which in turn can cause congestive heart failure. Eating healthy ways, and these foods need to be foods that's low in saturated fat, low in trans fats, low in sugar and sodium. With my talking to patients a lot of times, and I'm saying, okay, we need to watch your sodium. We need to, and I get the thing, I don't use the salt shaker. I have no salt shaker on my table, but the thing of it is we have to worry about what we call hidden sodium. So what's hidden sodium? Hidden sodium are in soft drinks. Hidden sodium is in processed foods that we eat, canned foods that we eat. So you say, well, okay, well, it's not summertime and we can't get the vegetables out of the garden. If they're not fresh, we need to eat frozen. And I know that gets a little bit expensive, and it does, but those hidden sodiums really kind of, they're shockers to people, and they need to stay away from that. Cheese is another thing that's full of sodium. So we need to watch that. So you need to think about fruit, fresh vegetables, lean protein, such as chicken without the skin, and good fats such as those in olive oil. Olive oil is great. Lose weight if you're overweight. Anytime you're overweight, it puts stress on the heart to do any activities, which makes the heart work harder. And if you know you have congestive heart failure, think you have congestive heart failure, keep your doctor's appointments. I can talk to you all day, but there's nothing like your doctor's advice, your doctor's appointments. How is congestive heart failure diagnosed? First of all, the patient has symptoms. I'm getting short of breath when I walk to the bathroom. I can't sleep lying down. My ankles swell. They see those symptoms. They need to go to the doctor. Physical exam, which your doctor will do. Then the doctor will do what we call an echocardiogram, and they are looking at the valves of the heart. They're looking at the muscle of the heart. And then, of course, the chest x-ray can show fluid that has regurgitated back up into the heart. Lab work and a heart catheterization. That heart catheterization will show what that ejection fraction is that we talked about in the beginning. There's a blood test that our physicians can do. It's called a BNP, and this is a marker for progressive heart failure. Is it always 100%? No. That's where your physicians will want to do other stuff to have a definitive diagnosis. Treatment of congestive heart failure is very important, and the number one treatment is self-care. Self-care is number one. You got the disease, you got to take care of yourself. And we discussed a few minutes ago, physical exercises, quit smoking, lose weight, low sodium diet. I can't say that enough. Weigh yourself daily and keep a log of it. And I'm going to show you a thing we give the patients, and it tells you about your weight gain. Fluid restrictions, if the doctor orders this. Okay, so let's talk about this now. Back in the 1980s, when I was first a nurse, everybody was on fluid restriction that had congestive heart failure. And we were also giving them diuretics to get rid of the fluid. So we were restricting their fluids, and we were giving them something to get rid of fluid. So we were having some patients who were having to go, they had to go back into the hospital because of dehydration. So that's why I say follow your doctor's orders. If they order fluid restrictions, that's important. Some physicians won't and some will. So make sure your doctor is your number one line of communication. And then they teach you some medications, and I'll talk briefly about these. And that would be your diuretics. Some may look familiar to you, some may not, like Lasix or hydrochlorothiazide. And with these medicines, your doctors are going to do blood work to keep your potassium. ACE inhibitors, and some of those are like lisinopril, losartan, beta blockers, and beta blockers are drugs that make your heart slow down so that heart doesn't have to work so hard to pump that fluid that it's got, or nitrates like Isodil, and that's basically for your chest. It kind of lets the muscles relax in the heart. We do, or there has been cases where medical procedures had to be done when patients had congestive heart failure due to the fact that medicines wasn't working, diet wasn't working, exercise wasn't working. And one of those was called cardiac resynchronization therapy. And that's when they try to get the heart back into rhythm, because when the heart's working so hard, it's very easy for it to have palpitations, atrial fib, and we need to get that heart back into rhythm, because the heart will work better if it's in rhythm, and it'll get rid of the fluid better. Implantable defibrillators, which I know everybody knows what a defibrillator is, but it kind of keeps the heart in rhythm, or heart bypass. And we all know what a heart bypass is. So let's talk about what you can do for your self-care, which is very important. Daily weights, and record those weights. You should have a record of your weights if you have congestive heart failure. Take your medications as ordered by the doctor. That's low sodium diet, and make sure you make follow-up appointments with your doctor, but make sure you keep them. That is so important. Okay, so this is the self-care plan that we give all of our congestive heart failure patients. And as you can see, it's broken down in 3 categories. And this talks about keeping up the good work is when you're in the green, okay? So what do I want you to do? Daily weights, okay? If you gain more than 2 or 3 pounds overnight, hey, that's a trigger that I'm retaining fluid, because nobody is going to eat enough food to gain 2 or 3 pounds overnight and it be fat on your body. It's fluid from something. Take your medications as ordered, low sodium diet, and follow-up visits with your doctor. Physical activities. Now, when you're in the green, you're good. Keep doing what you're doing. But then sometimes we slip and slide and we get down into the yellow, or this is looks a little bit orange. And this is where you need to use caution. Okay, I've noticed I've developed a dry, hacky cough. I got short of breath walking to the bathroom, or I've gained 2 to 3 pounds in the last night or so. So what should I do? And then you're having trouble sleeping. Now, if you're a person who sleeps on 1 pillow and the last couple of days you've had to have 2 pillows, that's a trigger. You know, we've got some regurgitation, we've got some congestive heart failure, because the patient will describe it as, when I lay down, I feel like I'm drowning, and it's the fluid backing up. So this may indicate that you need, or it does indicate that you need to contact your doctor. Hey, doctor, this is what's going on. And a lot of times they treat you from home. Okay, and they'll tell you what to do as far as your medication. But then we get down into the medical alert, or the warning signs that we need to call 911 or go to the physician's office. This is frequent dry, hacky cough, symptoms of shortness of breath. You can't even walk to the bathroom without just giving out a breath. Note that you can't tolerate any physical activity. Loss of appetite, and people lose their appetite because they have so much fluid. And this is the person who, they can't sleep on 2 pillows. They have to sit up in the chair. They have to sit up to breathe, to sleep. And this is the time that we really need you to call 911 and get to your doctor, because this is very important. Because people, you get a lot of fluid on you, and you have to come into the hospital. And this is when you gain 3 or 4 pounds over that in a 24-hour period. So always make sure that you follow your doctor's orders, write those weights down so that you will know exactly what you weighed yesterday and 2 days later, you're gained like 3 pounds. Yeah, that's a trigger that something's wrong. You're not going to eat that much food. Remember to watch those hidden sodiums that we so many times, and I think we're all guilty of it. You know, I hear people all the time, I don't have any salt shakers on my table, but yeah, they just drank a Pepsi Cola. Well, yeah, that's a lot of salt. But I cannot encourage you enough to be your front. Make sure that your doctors know what's going on with you. You keep your appointments with your doctors and you keep open communication with your doctors. Most physicians now have a patient portal. If you don't want to call, just type in something and they'll get right back to you. Right here are some resources. The care building, we have cardiology service as well as family care. And we're always here in the education department. If you ever need any information on these diseases, just call or drop by and we'll be glad to do that. Any questions?
It looks like Deborah put in the chat, easy to say exercise, hard to do. What exercises are good to start with?
Okay, Deborah, you are exactly right. Because when you have congestive heart failure, yeah, we have a hard time because we're short of breath. We might have swelling. Just a few walks in your house, walk back and forth to the bathroom, walk back and forth from one end of the house to the other end of the house a couple of times a day. But just always, if you get really, really tired, short of breath, make sure you sit down and rest. Does that answer your question, Deborah?
Yes.
I don't want anybody to think they have to go out and walk a marathon or get on a treadmill. Always check with your physician about any type of exercise regimen that you start, any type of diet that you start. You need to check with your physician about it.
We've got another
Any more
question. Do you need to check your pulse before taking your medication, and should you hold your medication if pulse is low?
Oh, great question. Okay, so people are on medications that do affect their heart rate. And I'm sure y'all are wondering one of those. One of those is beta blockers. Something like low pressure topral, it decreases your heart rate. The line of the rule is usually, as most physicians will say, 60, below 60, you need to hold it. But I would never hold my medication until we have the physician tells you. So if you wake up today and your heart rate is 42 and you're on a beta blocker, I will let my physician know before I hold it. We as nurses cannot hold medications unless we let the doctor know and talk to the doctor. Now, if this is something that happens right often, you need to discuss it with your doctor and get those parameters. So, hey, Dr. Jones, how low do you want me to have my heart rate before I hold my medicine? And get him to write that out for you so that you can have that at home and know when to hold it and when not to hold it. Any more questions?
I don't see anything in the chat, but we've got a few more minutes if you all think of anything else. We appreciate you all coming out today, and thank you so much, Teresa. That was very informative.
Thank you. And I appreciate everybody that joined and listened. And I'm always here in the care building in the education department. I have all kinds of educational stuff that I'm willing to share with anybody who has questions about I'm not a doctor, so I would refer you to your physician. But if he tells you, yeah, you've got atrial fib, you've got congestive heart failure, and I have all kinds of material that I don't even mind, don't mind mailing it out as well. So you could just call me at the care building.
Great, thank you. So we have recorded this. We'll be posting it on Facebook and on our website under CORE. So if you want to check that out, if you missed the first few minutes, or if you want to share it with family and friends, please do so. And we look forward to our talk next month. So thanks so much for coming out. Y'all have a good afternoon.
Thank you.
Bye-bye.